Hello, everyone. My name is Sukhdev, and today I'll be telling you guys about my Western Regional Public Health Training Center project, which I did with a collaboration through my internship at the South Asian Heart Center. So here's the presentation layout for today. I'll be doing introduction about my project along with the goals and methodology to be followed with the results and discussion section. And lastly, to finish off with some concluding remarks. So the introduction of my project. It's quite common knowledge that the South Asian population, is being disproportionately affected by, certain systemic health issues. And we see actually that the South Asian community is about 1/4 of the global population, but they're actually 60% of all the heart disease cases in the world. And this is an extremely concerning statistic. Along with that, meta-analysis of studies report that South Asians have higher incidence rates of coronary disease than their white counterparts. Furthermore, the impact of diabetes on one-year mortality is much stronger for South Asians than whites. Now, all these concerning statistics and data, begs the question, how can we help reduce this burden that we see in this community? So a little bit about the South Asian Heart Center. It's a nonprofit that mainly serves the South Asian population for high rates of disease within this community. Some examples of diseases are cardiovascular disease, hypertension, diabetes. And the South Asian Heart Center currently operates under the El Camino health system and is providing mainly telehealth services due to the pandemic. Their main two programs are the Aim to Prevent and Stop D program. The Aim to Prevent program is a culturally tailored coaching program, lifestyle coaching program, whereas Stop D is an adaptation of the DPP, Diabetes Prevention Program. The center also, has this opportunity for college students to get involved with an internship as a heart health coach, and that was something I did due to my interest in medicine. So looking at the goals and methodology, this is a timeline for my project. Objective 1 for my project was to translate and create handouts, videos, and workshops in Punjabi. We oftentimes see that the Punjabi community is not able to have access to the resources available to them simply due to this language barrier. And so it's important that we can address that issue. Objective 2 was to organize and facilitate diet and exercise workshops in the Northern California region. Now, oftentimes this community can be hard to reach. And, my initial, guess or, presumption was that we could better, do outreach to this community by going ahead and doing, in-person interaction or community outreach, which would be through, going and doing workshops at Sikh temples in the local region. Lastly, for objective 3, it was to educate and refer patients from a lodge clinic to heart health coaching at the South Asian Heart Center. So trying to identify those needy patients that need that extra care for their health. Looking at the South Asian Heart Center internship, my internship began in September of 2020, and I finished in November of 2021 for a total of 250 hours. And as an intern, my main responsibilities revolve around my role as a heart health coach. And so to become a coach, I underwent about 1 month of training to learn about blood tests, clinical terminology, diabetes, and many other clinical diagnoses. And along with that, my training also taught me how to conduct coaching sessions with participants. And so because of that, I was able to learn more about motivational interviewing, MEDS, which is these system that is used by the center to target different lifestyle components, meditation, exercise, diet, and sleep, along with communicating via email and phone calls. And I also learned about their EMR system and how to schedule and input lab exams. So I mainly worked as a coach for participants in the Aim to Prevent program. And so to become a coach, I did have to undergo some training in which I did, mock participant calls for yearly wellness checkups and monthly checkups with my supervisor and other coaches at the time. And eventually, after being a coach for some time, I also trained new interns as well. So my participant interaction. So during my time at the center, I would conduct yearly annual wellness checkups, YWCs, with participants of the Aim to Prevent program. And it was in these YWCs that I would talk to patients about their clinical history, medications, meditation, exercise, diet, and sleep. And my clinical recommendations to participants will be to take their medications daily, spend about 40 minutes daily doing meditation. So that would be two 20-minute sessions, along with exercising for at least 150 minutes every week in which they can get their heart pumping, along with to follow the plate method for their diet, which is 50% vegetables, 50% protein, 25% protein, and 25% grains or carbohydrates. And lastly, to sleep about 7 to 8 hours every night. So looking now at the collaboration between the South Asian Heart Center and the Western Regional Center. So I learned about the Western Regional Public Health Training Centers program and decided to use my learned skills from my South Asian Heart Center internship to further impact the community. And so in my mind, I wanted to help translate many of the flyers and documents of the South Asian Heart Center into Punjabi, so that way we can make a bigger impact on the Punjabi-speaking population, mainly composed of those from the Sikh faith. I also work with my supervisor to present my projects my project to several local clinics. And so I reached out to the Silicon Valley Gurdwara Clinic to share more about the program. I also reached out to Lodge Clinic and along with that, Shifa Clinic of UC Davis as well. Looking at the results and discussion of my project. So overall, I spent about 250 hours working for the South Asian Heart Center. And during this time, I performed YWCs with participants, scheduled lab exams, inputted lab results, and also fundraised for the South Asian Heart Center during their telethon drive to help raise about $3,500 myself. I was also able to make progress on my objectives for my Western Regional Public Health Training Center project. And so I translated 7 South Asian Heart Center flyers for nutrition and exercise from English to Punjabi. And along with that, I also contacted and attempted to institute my project program in the various clinics that I just mentioned. Unfortunately, though, the Silicon Valley Gurdwara Clinic did not wish to discuss this project. A Lodge clinic did allow me to present, but eventually declined to institute my project. And Shifa did not allow my project as well to be put into their clinic setting, but they did allow me to share posters, flyers, and contact, which they could share with their patients, so that way they could refer any needy patients to the South Asian Heart Center. And so to address the obstacles I faced and to try to, still somehow make an impact in the community, I did attempt to reconnect with some South Asian Heart Center participants that initially were recruited through the Silicon Valley Gurdwara Clinic. And so of those, I was able to call 70 participants and conducted 15 YWCs. To finish off now with some concluding remarks. So what I learned it's really important to recognize that each cultural community faces obstacles in receiving healthcare. And additionally, clinical advice that's given to the patient needs to be done so in a culturally tailored manner. Oftentimes we see that healthcare, in a healthcare setting, that patients are told, to eat better or to, exercise better. But this advice is often given without an understanding of the patient's lifestyle. And each patient is so different in the way they live their daily routine. And so I think it's really important to understand that routine varies so that way we can give care that is, culturally appropriate and can specifically help improve that patient's health. The South Asian Heart Center has been trying to do this very type of idea and it's been able to make an impact towards the systemic health issues that the South Asian community struggles with. Furthermore, outreach is key, as oftentimes certain populations can be resistant to communication. So, going to Sikh temples and also known as Gurdwaras can actually help us with reaching this invisible community. A lot of times this community is not able to have access to, as I mentioned earlier, resources that are available in English, or they simply are just, not as adept at technology and therefore are even harder to reach than another population. And so I think for my experience and going forward, I think the best way for us to reach out to this community would be through in-person interaction at their, local native facilities. Along with that, it's also important to, as I mentioned, recognize that resources must be available to participants in an easy, accessible format, something that is, in their native language and also is, an easy to understand format, something that they can access easily. Lastly, I plan to incorporate this project into my Master's of Public Health program next year at UC Davis. And so my idea is I want to be able to, create this culturally tailored coaching program, just like the one I was a part of, for any type of provider in the local area. And along with that, in tandem, there would be kind of a system by which the provider could follow in order to give culturally tailored care to their patients. And so my idea would be you would have a system where patients can walk in, meet with a physician who has the ability to provide care in a culturally competent, along with culturally humble way. So incorporating cultural competency, cultural humility, and if needed, those patients that are, needing to improve their health at a greater level can be referred to this culturally tailored lifestyle coaching program that can effectively make changes in their life based on their daily routine. Lastly, I want to give my thanks to Abigail at the Western Regional Public Health Center, who has been such a huge help with this project. She's always been there to ask my questions. She's been my go-to for communication wise with the center, and has been very patient and has also, been great in keeping me on track with this project. Lastly, I want to give my thanks to the South Asian Heart Center, specifically my supervisors, Ashish, Anita, and Prajakta, for their hard work and for training me to be a coach. So thank you again to everyone for this opportunity and for listening to this presentation.